Today is the hypertension, hyperlipidemia, and obesity. The objectives for today are to review the prevalence of hypertension, hyperlipidemia, and obesity, look at how the three conditions correlate and why it's important to treat these conditions, identify key areas of medically managing the three conditions, and review lifestyle changes and self-management goals for patients living with these conditions. So some statistics around high blood pressure. Approximately 30% of adults that have hypertension, adults have hypertension. So about 30% of the population have hypertension. Half of the population with hypertension do not have their condition under control. Nearly 1 in 3 American adults have signs of prehypertension and are at risk of developing hypertension. It's most prevalent in folks age 55 and older. Men and women are almost equally affected, and African Americans are more likely than Caucasians to have hypertension. Some facts around obesity and hyperlipidemia. 33% of Americans have high levels of LDL cholesterol. That's about 71 million people. A third of the population with hyperlipidemia do not have their condition under control. More than 60% of adults are considered overweight or obese based on their body mass index, or often referred to as their BMI. More than a third of children and young adults aged 6 to 9 are considered to be overweight or obese. So reviewing these statistics, note the number of Americans that have one or more of the conditions and how many are not in control of their disease. We would like to review a video. This video was provided by the Million Hearts Campaign on hypertension and provides some key talking points to share with patients related to the importance of taking medications and how lifestyle changes all work together and to improve a person's health, as well as more safely managing high blood pressure, also known as hypertension. So I'm going to take a few minutes to review the video, and then we'll continue the conversation with the webinar.
Like millions of Americans, Emma was living with high blood pressure and didn't know it. There were no early warning signs or symptoms. But Emma's heart was working overtime, putting her at risk for heart disease and stroke. Following a physical, Emma was diagnosed with high blood pressure, also called hypertension. People of all backgrounds can develop high blood pressure based on risk factors. Family history, but hypertension can often be controlled with healthy habits and medication when necessary. Eating more fruits and vegetables, following a low-salt diet, exercising regularly, and quitting smoking are often the first lines of defense to control high blood pressure. Your doctor may prescribe 1 or more medications to help lower your blood pressure to normal. Some rid the body of extra sodium and water. Others reduce the heart rate or relax the blood vessels. Always take medications exactly as prescribed, and don't skip doses. While medications can effectively lower blood pressure when taken correctly, each type has potential side effects for some people. You might feel tired or have trouble sleeping. You may experience a dry cough, stuffy nose, blood cramps, frequent urination, or headaches.
So we're not...
No side effects. Focus on the benefits. Taking your medication regularly will lower high blood pressure and protect your brain, heart, and kidneys from life-threatening consequences like stroke or heart attack, often the first scary signs of hypertension when left untreated. Control your blood pressure and reduce your risk by knowing your goal numbers and monitoring your blood pressure at home or at your local pharmacy in between doctor's visits. How's Franny?
She just graduated from obedience.
Pharmacists play a key role in working with your physician to improve blood pressure management. We can address medication concerns and challenges. So talk to us about your treatments and goals outlined by your doctor. If taking your medication feels like a chore, Don't just stop taking it. We can counsel you on working through side effects or determine when you need to see your doctor about possible changes in your medications. And we'll share healthy lifestyle tips to keep you on track. Whether you monitor your blood pressure at home or in the pharmacy, we're here to discuss your numbers and provide guidance. Okay, Emma, you're all set. I'll see you back here soon. Visit millionhearts.hhs.gov to team up with your pharmacist to bring your blood pressure down.
Okay, so that video gives some nice talking points that you could use as you're conversing with patients, or you might even want to share the website, the link to the Million Hearts campaign as well with patients. That would be a nice support and resource for you. So next we want to talk about diagnosing the different conditions, and we're going to start with hypertension. So as mentioned in the video, hypertension is the clinical term used for high blood pressure. The normal blood pressure values ranges from 90/60 to 120/80. People with hypertension have blood pressure greater than or equal to 140/90. Often, patients have no signs or symptoms of hypertension. It is a chronic condition, meaning there is not a cure, but it can be managed. Also mentioned in the video, treatment focuses on lifestyle changes such as healthy eating and staying active, and when necessary, adding medication. Next, we want to talk about diagnosing hyperlipidemia. So hyperlipidemia is a clinical term for high cholesterol. Sometimes it's also called hypercholesteremia. The cholesterol is a natural substance that's found in our blood and nerve cells. Foods that contain cholesterol, specifically are animal fats. Common sources include eggs, meat, cheese, and other dairy. The normal values for total cholesterol are less than 200. For LDL, or also known as the bad cholesterol, less than 100. The HDL, which is the good cholesterol, should be greater than 40 for men and greater than 50 for women. And for triglycerides, ideally less than 150. Hyperlipidemia is classified as a chronic condition by the Center for Medicare and Medicaid, and as with hypertension, treatment focuses on lifestyle and/or medication. Next, we want to talk about diagnosing obesity. So according to the Center for Disease Control, obesity is defined as weight that is higher than what is considered as a healthy weight for a given height. It is determined by a person's body mass index, again the BMI, which is an estimate of body fat based on the person's height and weight. Normal BMI is 18.5 to 24.9. A BMI of 25 to 29.9 is considered overweight, and a BMI greater than or equal to 30 is considered obese. Obesity is a serious concern because it is associated with poor mental health outcomes, reduced quality of life, and the leading cause of death in the U.S. and worldwide, including diabetes, heart disease, stroke, and some other types of cancer. Note how the three conditions we're reviewing, hypertension, hyperlipidemia, and obesity, directly impact one another. Obesity serves as a risk factor for hypertension and hyperlipidemia. Foods high in cholesterol are usually also high in calories, which contributes to obesity. And the buildup of cholesterol in the artery walls can restrict blood flow, which then increases blood pressure and can lead to hypertension. So all three are directly correlated. This slide reviews the risk factors and can show how each of them again are correlated. So risk factors for hypertension, hyperlipidemia, and obesity are nearly identical. Understanding patients that are at risk for these conditions really helps empower the healthcare team in early diagnosis and treatment. That's really ideally what we'd like to do, is early identify and treat. One of the risk factors is when there has been a family history of the hypertension, hyperlipidemia, and obesity, many of the lifestyle items such as smoking tobacco, unhealthy eating, lack of exercise are greater risk factors. Focusing on the self-management tools to address the lifestyle changes are where the care team can really support the patient to move towards better health and reduce their risk of developing one of the diagnoses. So now let's talk about the ways we can support the lifestyle changes and also looking at the medication management. So medical management of hypertension. In addition to managing the conditions with lifestyle changes, medications may be used. This table lists common medication classes and drugs used to manage hypertension. If you are a community health worker or a medical assistant, reviewing these medications and being familiar with the names would be important to you. If you are a person with additional clinical training, such as a nurse or a medical social worker, you might want to take some time to look at each of the medications in more detail in understanding the classifications and the treatment. But for today, we're just going to familiarize you with the names and the different classes. Also part of managing hypertension is very dependent on a patient's blood pressure reading. And a correct blood pressure reading is critical for providers when they're selecting the correct type of medication and dose of the antihypertensive medications. Key actions for accurate readings are, ideally, we'd use an automated cuff. If that's not an option and you are using a manual cuff, then these are some suggestions that we would strongly encourage you to take in consideration. First, deflating the cuff slowly. It's also important to prepare the patient. So preparing the patient would include placing the cuff on a bare arm with the cuff entirely covering the arm circumference, ensuring proper positioning, having the patient seated in a chair with good back support, having them plant their feet firmly on the floor, legs uncrossed and arms supported. They should have an empty bladder, refrain from talking with the patient during the reading, and if the blood pressure is over 140 or 90 or higher, confirming the reading with a repeat blood pressure. So those are some helpful tips. Next, we're going to review a video that gives a demonstration of this, and it will take a few minutes to listen and watch the video. Okay, so we've had opportunity to hear about the important steps as well as a video to demonstrate that, so thank you. We now want to cover the medical management of the hyperlipidemia. So in addition to managing the hyperlipidemia with lifestyle changes, medications may be used. This table provides a list of the common medication classes and drugs. And if you want to take a few minutes to look at that, that would be helpful. Do note statins should be taken at night because most cholesterol is synthesized or produced when the dietary intake is at its lowest, which does occur overnight. So a good fact to know. In the lifestyle changes to help address hypertension, hyperlipidemia, and obesity, we want to think about the significance of that. And here we have listed some examples that the provider might advise. As care team members, we can partner with patients to provide support. In ways we can provide support to the patient would be assisting them in developing their own individual action plan, identifying steps that they would see as realistic that they could take, not ones that we suggest. It needs to be individualized and something that's important to the patient. Discussing some potential barriers or situations that might get in the way of the action plan, and then problem solving through these, as well as developing a commitment plan for the follow-up and monitoring goals in the action plan. This could be a member of the healthcare team. If that's not possible, it might be another person that the patient would identify as helping them maintain the commitment in their self-management action plan. And so we might center around different ways of improving their healthy eating, perhaps reducing the amount of salt in the diet. If they're overweight or obese, looking at opportunities to lose weight. Avoid drinking too much alcohol if that's the issue. If they're smoking, looking at putting an action plan to stop smoking, looking at ways to reduce stress, and incorporating exercise. And what we do know that 30 minutes per day is the recommendation today. And so if we're working with folks, helping them identify ways to increase their activity on a daily basis. The importance of physical exercise has a tremendous impact on the management of the chronic condition. It does this by improving the blood pressure and cholesterol level, can decrease weight. It lowers the risk of type 2 diabetes, heart disease, stroke, and even some cancers. It strengthens lung muscles and joints, can slow bone loss, increase energy levels, can help with relaxation, coping, and stress management, and can promote better sleep. So those are all the importance and the values of physical activity. When we're looking at managing the conditions, we look at different metrics that are used to help the care team. First, identify patients at risk for having one of the conditions, and if they have the condition, determining whether or not the patient is in control of the condition, or if they have out of control or what we would call gaps in care. Ways to do this: one, annually the physician will want to complete an exam that would include an accurate blood pressure, a lipid profile to include the high density lipid and low density lipid panel, and obtaining a height and weight that we would then use to determine their body mass index or BMI. Depending on tools available in the practice, the care team will use registry tools or electronic medical records with registry-like reporting tools to help figure out what tests are needed. Ideally, that would be prior to the patient's visit, and we call that pre-visit planning. The reason pre-visit planning works so well is if we can have the tests completed prior to the meeting with the treating provider, the provider and the patient can have a conversation about the results, and perhaps others on the care team or the provider can then have a conversation on lifestyle changes and the medical management for treating and managing that condition. So pre-visit planning is ideal, and ideally we would have the results before they come in for the appointment, and that would then lead to much better visit and outcome for the patient. Listed here are the references that we cited to put this presentation together. So if you would like to learn more, certainly encourage you to go to these reference sites. And more information is available there for your continued learning and education. With that, we really precluded what we wanted to cover today on the hypertension, hyperlipidemia, and obesity. So we'll now open it up to any questions. So we're going to unmute the line and anyone with questions at this time. Okay, not seeing any. So just as a reminder, after the webinar, please go to our website, complete the evaluation. If you are a medical assistant, you can also make a copy of the agenda and the certificate, and that you can then use that information for your certification. For folks that are working with patients, some key things are the early recognition, encouraging patients to take their medications regularly. That's always can be a challenge with patients, so any encouragement you can help them with those. And then really encouraging them with the self-management action planning and looking for ways to improve their lifestyle. So in conclusion, those are some things to think about. We will have the webinar available on the website. So if you have colleagues that you think would benefit from this, that will be available to them with a recording. And I think that's it. So thank you for everyone for attending today. We look forward to having you join us presentation.